Imagine you're an 8-year-old child having to complete a math worksheet before you go outside and play. As you start, you notice a bird flying by the window. You run to the window to see what that bird's going to do when you notice and hear a dog barking on the other side of the house. So you start heading over to that side of the house when you see your Legos sitting on the stairs. You decide that you wanted to make an airplane out of the Legos. And so on your way over, you start running, and then you run around the couch. And then you decide you want to take a couple more laps around the couch. Then you notice a tissue box sitting on the coffee table. You pick up a tissue and throw it in the air and watch it float down. Then you decide you needed to do that again, and again, and again. And then you realize that airplane that you could make from the Legos. So you start going over there to build that airplane. This is the life of an ADHD child. Today I'm going to talk to you about what it is and the 3 different types of symptoms and how you can manage it with your child. ADHD stands for Attention Deficit Hyperactivity Disorder. According to the Centers for Disease Control and Preventing ADHD and Prevention, ADHD is one of the most common neurobehavioral disorders of childhood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, and may act without thinking about what the result will be, or they're overly active. A lot of research has been done to determine what the causes are of ADHD, but none have been identified yet. The National Resource Center on ADHD states that heredity makes the largest contribution to the expression of the disorder in the population. But in instances where heredity is not present, difficulties during pregnancy, prenatal exposure to alcohol and tobacco, premature delivery, significant low birth weight, excessively high body of lead levels, and postnatal injury to the frontal lobe regions of the brain also have been found to contribute to the risk for ADHD to varying degrees. Now that I have gone over what ADHD is, I'm going to tell you what the 3 different types are and the characteristics that are associated with these types. The 3 types are inattention, hyperactivity, and impulsivity. Referring back to that 8-year-old child, our task was to sit and do math, a math worksheet, and complete our task. This is the symptom of inattention. With children with this symptom find it hard to stay focused and complete their tasks. After doing something completely different from what they are supposed to do, they tend to bounce back from task to task. They tend to bounce without completing any of them, and they also have trouble with concentrating. Another symptom of inattention is that they are easily distracted with things that are going on around them. Another symptom is hyperactivity. Back to that 8-year-old, we found ourselves running around the couch multiple times for no reason at all. We had to do this a few times as if we were driven by a motor. Of course, being 8, most kids are naturally active, but with ADHD children, it is nonstop. They may be very fidgety and they can't sit still in instances where they should be sitting quietly. You may notice that they are tapping their feet or shaking their leg. This is most noticeable in classrooms where they should be sitting quietly. A child ADHD will also get out of his seat with no purpose but just to move around. Another symptom of ADHD is impulsivity. That same 8-year-old child that was pulling the tissue out of the box and watching it float down without thinking about the consequences of having to clean up the mess. Children with ADHD act on their first impulse. They tend not to think of the consequences. That would cause a problem with self-control. Children with impulse symptoms of ADHD also tend to be moody and to overact emotionally. As a result, others may start to view the child as disrespectful, weird, or needy, according to the Help Guide on ADHD. On August 12, 2009, U.S. News did a report on how to take a drug-free approach to managing ADHD. Positive parenting, treatment programs, meditation, better sleep, and diet are all some of the ways to lead a drug-free approach. Another way is with medication. Some medications are stronger than others, but with trial and error, you can find the right medication that is right for your child. ADHD is a lifelong battle. Knowing what it is and identifying the symptoms, you can determine which approach is right for you and your child. Thank you. Now I'd like to open up the floor to any questions anybody may have. Yes?
Do children often outgrow ADHD?
Most children do not outgrow ADHD. It is something that they carry on through adulthood. But learning how to manage it and taking the right steps, whether it is with medication or not, they can lead a healthy and prosperous life. Yes?
What age can they be diagnosed with ADHD?
Usually children at age 6 or above, when they enter in school, is when they are diagnosed. It is hard to tell in children younger than that due to the fact that children are just naturally active. Yes?
Is there any help in school for children with ADHD?
There are many different types of programs that help with ADHD. Depending on your child's needs, you can talk to your child's psychologist and work out a 504 plan and get the schools have the schools involved in your child's education and dealing with ADHD. Yes?
I suspect several of my children have ADHD. I would like to know what steps I should take.
In trying to figure out if your child has ADHD, if you have any questions, you would always consult your pediatrician, and then they would probably refer you to a child psychologist. But the best bet is, if they're in school, just to talk to your teachers, your child's teachers. If they suspect that maybe they're having problems staying focused, they tend to get out of their seats often, that maybe it could be ADHD. But if it's something that is consistent, then it most likely will be ADHD. But if it's something that's just temporary, something that just recently started, it could be other factors. So always just talk with your teachers and then consult your pediatrician. Thank you. Yes?
You mentioned diet. Is that gluten-free? Does that work?
A lot of research has gone into non-medication approaches. There is some research saying that gluten may be a factor, but that depends on your child. If they show symptoms of having an allergic reaction to gluten, that it could be. But again, talk to your pediatrician. One more question. Thank you. Yes?
Do you have personal experience with ADHD children?
I do have a personal experience. My 8-year-old child is ADHD. It is actually something that his pediatrician had noticed from the moment he was born, just because of his activity level. He would be classified as having all three symptoms. And we just work with his teachers, his psychology and his psychologist, and his pediatrician, and we're on the right path into helping him manage it. Thank you, everybody. Everybody?
I'm Josie.
Just walk by.
Please.
So I can walk by.
And our lovely cameraman.